Hey everyone, if you're a nursing student staring down a mountain of care plan assignments, I get it, writing a detailed, accurate care plan can feel overwhelming. But stick with me, because in the next few minutes I'll break it down step by step, so you can craft care plans that are clear, patient-centered, and bound to impress your instructors. Let's get started with the basics. The care plan process usually follows 5 key steps: assessment, diagnosis, planning, implementation, and evaluation. First up, assessment. This is where you gather vital information about your patient, think health history, current symptoms, physical exam findings, and lab results. My tip: be thorough, but focus on the data that actually matters for your patient's main problems. Now onto the nursing diagnosis. This is where clinical reasoning kicks in. It's tempting to copy textbook labels, but dig a little deeper. Identify actual or potential issues that you as a nurse can address. For example, instead of just writing risk for infection, specify why your patient is at risk. Maybe it's due to a surgical wound or immunosuppression. That level of detail shows you really understand your patient's situation. Next is planning. Set clear, measurable, and realistic goals. Make sure each goal is patient-centered and time-bound. For example, instead of saying, the patient will improve mobility, go with, the patient will ambulate 50 feet with assistance within 48 hours. See how specific that is? It makes tracking progress much easier. Implementation comes next. These are your nursing interventions, what you'll actually do to help the patient achieve those goals. Prioritize evidence-based actions and always include the rationale behind each intervention. For instance, if you're encouraging mobility, explain that it helps prevent complications like blood clots or pneumonia. Finally, evaluation. This is where you check back on your goals. Did your interventions work? What needs to change? Document what you find and be honest, sometimes goals aren't met and that's okay. The important part is showing your thinking and next steps. Before you go, here's a bonus tip. Use templates or mnemonics like ADPI to keep your care plans organized. And always proofread. Clear professional language makes a huge difference when your instructor is grading. So to recap, focus your assessment, personalize your diagnoses, set specific goals, explain your interventions, and evaluate honestly. With practice, you'll find care plans become less stressful and even a bit rewarding. Thanks for watching, and good luck mastering those nursing care plans.